you, Mr. Clerk. And thank you. Mr. Clerk, please call our next item.
Agenda item number 4 is a hearing on suicide, domestic abuse, and family violence during the COVID-19 pandemic. Members of the public who wish to provide public comment on this hearing should call the public comment number 415-655-0001, enter the access code of 926-116-335, press the pound symbol twice to connect to the meeting, and then press the star key followed by the number 9 to enter the queue to speak.
Thank you, Mr. Clerk. Vice Chair Stefani, this is your hearing. Thank you for introducing it. The floor is yours.
Thank you, Chair Mandelman, and good morning, Supervisor Walton, and to all those on this call. I'm glad we're having this hearing today. You know, from the onset of this pandemic, one of my foremost concerns was the impact this crisis would have on the mental health and well-being of all our residents, particularly of those who are in already stressful, dangerous situations. And at the onset, I also sent out an email to all of my constituents and everyone on my list about basically saying, you know, there's no shame in admitting that this is going to be very difficult, especially for those who suffer from anxiety, depression, those who are in recovery. If you know anything about addiction, those who need to deal with their addiction often go to 12-step meetings, and those meetings keep people sober, they keep people on track, they keep people out of isolation. And right now, people aren't able to meet like they once did. They can meet on Zoom, but it's very difficult for people at this time. And you know, a lot of people that are trying to get sober at this time, it's really difficult. And I just want to recognize that it's okay. It is okay to have anxiety. It is okay to be depressed, and it is okay to suffer from addiction and want to get help. I called this hearing on suicide and domestic violence during this COVID-19 pandemic because I am extremely worried about the real human consequences of sheltering in place. And like I said, you know, I just really want to recognize that these are extremely hard times. And like I said, it's okay not to be okay. And I feel like so often in society, we have this idea that, you know, if you can't handle the heat, get out of the kitchen, where, you know, really, if you can't handle the heat and you're in the kitchen, just ask for help, and that's okay. You know, this toxic masculinity where, you know, men don't get to show their emotions and they don't get to ask for help like they should be able to. And when you look at what's going on in our country right now, you know, the fact that we've lost 100,000 Americans in just a short period of time, I mean, all those people are connected to so many families, and it's hard, especially for people who are sensitive, to see that news and to see the reports of who we've lost, and not to like feel that and not to have that tug at your heart. We know that 1 in 9 San Franciscans are, you know, our fellow citizens are unemployed. We have an 11% unemployment rate. We are absolutely worried about people's livelihoods, people who started their small businesses, their restaurants. We're worried about the recovery. So many people are worried about how they're going to put food on their table for their children. We're also worried about the loved ones we can't see. You know, I've shared with people before that, you know, I have a dad who lives in Merced who suffers from Lewy body dementia. And I haven't been able to see him since March 1st. And that does take a toll on me, and that's okay. We're in a political climate right now where we have leaders who think it's okay to be cruel to one another. We have leaders who are not setting a good example of getting through this crisis with love and dignity and understanding that people come to issues with different experiences. We see how our president behaves. And I think the totality of all that and how it affects people, and when you're isolated and you can't be with your friends and family like you once could, takes a toll. And again, it's okay not to be okay. When I look at what's happening with domestic violence, I was extremely alarmed to hear that the Domestic Violence Consortium reports that cases of domestic violence, intimate partner violence, and child abuse are increasing across the city. San Francisco Suicide Prevention reported that they have seen a significant increase in the acuity of callers that require immediate emergency intervention. I've had notifications from our chief of the fire department and notifications that we get about suicides that have happened in my district at a rate that I don't normally get those notifications. They also report seeing a 22% increase in the first-time caller in the first month of first-time callers in the first month of the shelter-in-place order. And overall, they have serious concerns that an even larger spike is in our future. I'm really extremely concerned about this as San Francisco's face the stress and anxiety of rebuilding their lives after the orders are lifted. I believe that we should do what we can to understand this issue and to prevent our residents from harming themselves or others. Today, we are fortunate to have with us Lanai Sheth from the Felton Institute and San Francisco Suicide Prevention. Also, we have Beverly Upton from the San Francisco Domestic Violence Consortium. And we also have Emberly Cross from the Cooperative Restraining Order Clinic to answer questions about the courts. They're here to report on what they're seeing in the field and to give us insight into how we can better serve those who are in distress. I also want to thank my aide, Andy Mullen, who has been there every step of the way on this issue and who helped bring this together. I'm very fortunate to have the staff that I have, and I want to recognize his hard work. And with that, I'd like to turn it over to Lanai. Line, I think. I'm sorry. I think I got it.
It's
Lina.
okay. It's
Lina.
yeah,
Lina.
Lina. You got it. Lina Sheth. Hi, everyone. Thanks for having me join you this morning and share with you some issues that we're starting to see at San Francisco Suicide Prevention Felton Institute. I'm going to just upload figure out how to do this now. Here we go. Okay, I guess I have to have that up.
To Ms. Sheth, if you're,
Yeah.
Actually, it looks like you're getting it there.
Did I get it?
A little closer.
How's that? Can you see it now?
Can you bring that to full screen?
Yep.
Looks good.
Okay, thank you. Okay, so I'm going to start here. So we're going to talk a little bit about suicide and mental health in the COVID-19 era, and we're just at the beginning of this era, really. And my name is Lina Sheth. I'm the interim director at the San Francisco Suicide Prevention, and I've been there for the last year and a half as we transitioned and merged. Let me tell you a little bit about that. We're going to talk a little bit about San Francisco Suicide Prevention Felton Institute, and then do an overview of suicide trends in San Francisco over the last few years. And then we'll talk a little bit about suicide and mental health in the COVID era, and then some considerations and recommendations to consider for the future. I just wanted to give this fun fact that, you know, Bernard Mays came from England and actually started the first hotline in San Francisco in the country. And, you know, he was also one of the founders of NPR, KQED here. So San Francisco Suicide Prevention Felton Institute provides 24/7 emotional support to those in and affected by any kind of crisis, including individuals that experience suicidal ideation. And last year, I think several of you know that we merged with Felton Institute to really try to bring a community response to suicide in a broader clinical continuum of mental health and social services. So while suicide prevention is about 56 years old and Felton is 130, Felton's the provider of the largest outpatient mental health services here in the city. And we felt like it would be a really good bridge to not just work with people kind of at the sort of tail end of their mental health, or at the beginning of their mental health crises, but to try to figure out how do we kind of create a better continuum of services. And Felton has really been able to modernize operations, staffing, and infrastructure to enhance our program capability already with, we had to go remote kind of almost like immediately when COVID hit, and we didn't have that infrastructure in place. So we were able to do that also with a partnership with a couple other companies, and then text and chat capacity. We've been wanting to do that for many years, and now we're able to. So what does suicide trends look like in San Francisco? As you can see, this is coming out of the Department of Public Health Community Health Needs Assessment last year that was released. And this is sort of the rate of suicide across different age, ethnicity groups, as well as sort of suicide is the 12th leading cause of death in San Francisco. And, completion is much more common amongst men than women, and the average age is 50.96, 51 years old. And we do see the highest rate in the Castro neighborhood. So really amongst most likely the LGB communities. But it is widespread across the city. Looking at a SFUSD high school and middle school survey, social isolation is often a precipitating factor to suicide. And some of these concerning trends already in the environment, because young people actually are at highest risk of attempting, is that 13% of SFUSD high school students and 20% of middle school have considered attempting. And of course, that goes up for LGBTQI SFUSD students up to 32 to 40% considering. And we see low income SF residents at 3 times more likely to experience serious psychological distress. So I think these are concerning trends because within the, and we'll talk a little bit about within the COVID, but I just want you to hold those data points. So what does San Francisco Suicide Prevention do? We have 24/7 hotlines. We do some peer-led grief support groups. And we also do a lot of outreach in the schools because of this sort of concerning trend, particularly in SFUSD schools. And we also do some education in the community as well, and with the police. So this is what we saw last year. We answered over 82,000 calls last year, and that was a real spike from the previous year of 56,000. And we're not really sure what that was attributed to, other than I think what Supervisor Stefani kind of talks about, just sort of this real negative environment that increases anxiety for many of the callers and increased depression. But you can see here we have 4 different lines that we work with. An HIV 24-hour line, actually, even though it's called the Nightline, it's the only one in the country. A drug relapse prevention line, and then our general crisis line. The other is an access after hours line that we work with the Department of Public Health to answer their off hours. And this is kind of the primary reason why a lot of people call in. You can just see. And on the community education side, we serve about 6,000 youth, and we were in 40 sites. And a lot of those sites we do see a lot of young people calling in into the hotlines once we do like a one or 2 hour presentation. And this is sort of a referral, the referrals we offer, how many people are trained, but you'll see that we also do a lot of work with the police and 911 to make sure that we have a partnership, and that police are also trained in de-escalation techniques when they're out there. So what have we been seeing once shelter in place got put in? I mean, what's interesting, and this has sort of been a trend actually nationally, we're not unique around this, definitely in the Bay Area, is that we actually saw a significant decline in call volume. And we don't understand this trend, but the kind of the general Bay Area has really experienced this. There's separate lines for each Bay Area county. So I think that's just kind of interesting for us to understand why there's a reduction. But on the other hand, we do see this increased acuity. In other words, people that are planning, have solid plans to harm themselves, has gone up from 1 to 3 per month to 1 to 3 per week. So what we do is we coordinate with emergency services, either the police or 911, and have to go in and do an intervention with the caller. Like the callers sometimes are actively already engaged in harm, i.e. taking a bottle of pills, or, you know, standing, you know, calling and standing like on a highway entrance or bridge or something like that. Two, within 24 hours, they could actually act on their plan. So that's what that acuity means. The good news, so that's kind of the hard news that we've seen. The good news is that even though we have reduced call volume, we're seeing that 22% of new callers, usually with reports of anxiety, mental health, and relationships, are really kind of asking for some support. And they're new callers, because we do get a lot of repeat callers on our line, you know, just to be able to kind of make it through the day, some of them call, you know, once a week or something like that. So the other good news is that 30% of the callers, we've seen an increase for referrals, behavioral health referrals. So people are really seeking, you know, based on maybe new anxiety, old anxiety that's been triggered, or even substance kind of struggles, that they're really asking for support. And I think that's really good news. The other bullet, when I spoke with a physician that works over at CPMC, who's on our board, used to be on our board, he was saying that some of the challenge they're facing in their with folks that have suicidal ideation is the medical supply chains have really been disrupted with COVID-19. And so they're having access with that supply chain to keep patients stabilized who have suicide ideation. So just to wrap up, you know, like, what are some considerations we're kind of seeing and sensing? I think in this rapid response period, you know, while we're in shelter in place and for the last 8 weeks, and obviously we'll continue to monitor like how many people do talk about COVID and don't. We are kind of recording that. You know, I think it just requires this increased or sustained support that need to stay in place, right? For San Franciscans with existing mental health issues, I think there's emerging stress and anxiety. And who are the new vulnerable individuals, right? Supervisor Stefani talked about 11% being unemployed now in San Francisco, and really seeing, even from the fire department report, an increased suicide attempts or success in District 2. I think we're starting to see some emergence of new vulnerability we might not have seen before. And I think during the recovery phase, like, I am glad that the mayor has included in the recovery bond, you know, some health and mental health resources. But I do think that expanded services at every level, not just at our hotline level, but obviously at different stages, sort of entry to sustainability of people with chronic mental issues. You know, the system's already beyond capacity. So, and, you know, like I said in the slide, acute at the community and the hotline level. So how are we gonna, you know, be preparing for higher need and opportunities to intervene? And COVID-19, we've been really lucky with great public health and leadership, all of your leadership, to sustain, kind of a minimal impact compared to, say, other cities across the country. But I do worry about, as COVID-19 does sort of continue to have second and third waves, what's that impact going to be on people's mental health and grief related to that. So I will stop there. Thank you. And here's our number. So I think this is a very important number, 415-781-0500, that you could call 24/7 if you feel like you need support of any level. Thank you.
Hi, Lina, I just have a few questions if I could follow up, Chair Mandelman.
Yeah, absolutely.
From the data that you presented, we can see that suicide doesn't impact all communities equally. And I'm wondering if you're aware of any risk factors that work well to identify potential suicide or suicide ideation in others, and what are the most effective ways to reach those people before they get to their breaking point?
Mm-hmm. I mean, I think having a broad array, I think to support mental health, I think it is that broad array, multi-approach to, like, between hotlines, between on the ground programs, that the community-based programs are, and then, for acute, I think it's, making sure that there's enough hospital beds available. So it's a spectrum of intervention. I don't think there's just one thing that's going to solve this. Housing, is key to support folks to organize around their, if they're homeless, to organize around, wellness and structured settings. So I think we can't just look at this as a sort of one-stop solution. That mental health over the years, stress and anxiety build. And really, if you look at it from an equity lens, a racial equity lens, a lot of these issues are long-term, that really start sort of at the prenatal level. So it is a whole system solution, and I believe. In terms of sort of the differences across different age groups and race ethnicities, I think there are solutions that communities are trying to really foster, just that there is help out there. 50 years ago when this hotline was started, don't forget how stigmatized mental health is. So I think in different communities, the stigma of mental health still is real. And I think the stigma of suicide is still very real in our society. There's a lot of shame around it. And I really appreciate how you opened up this session to say that there isn't any shame around asking for help, and that, someone's always out there to help. Yeah. Thank you.
Thank you for that. And, you also mentioned social isolation can increase the risk. And we know we're all doing a lot more isolating now. And into the foreseeable future, we really don't know. And, another thing, with isolation, for anybody who knows anything about the disease of alcoholism and addiction, is like, people say your disease wants to get you isolated. Your disease wants to get you alone. Your disease wants you to drink. Your disease wants you to take that drug. And, we see reports of the drinking, I think it's like 40% up. And, there's kind of jokes about people are drinking their way through this. And it really has me concerned that, that isolation tendency for addicts to do anyway, and then being forced to isolate, the compounding of that is creating a whole new sort of threats for those who suffer from the disease of addiction. And I'm wondering if you have any suggestions about new creative ways we as a city could reach out to those who are suffering during this period of increased isolation, and especially those who are, suffering around a disease that tells them to isolate anyway. And in that isolation, often does end up in relapse or and oftentimes suicide.
Yes, I think that's why these lines are so critical, because part of our work is a drug relapse line to really kind of reduce that isolation. And I think a lot of the providers, like in the mental health and social services arena, are really thinking creatively around how to sustain their touch points through telephone and video calls to really keep that isolation down of people that they are in touch with. But I think we as a society are really trying to figure out, how do we sustain that social touch in a way we never have? Because I think social media can only go so far. The telephone or video calls seem to be more higher touch. And I know this is an issue really also for seniors, particularly as they really are super isolated, to be able to stay safe. And I have heard of a lot of senior programs really doing concerted efforts around, as they do, some have, shifted to food delivery. They do personalized notes, or they do phone calls to those seniors to try to really reduce the isolation. But I do believe this is a societal question that we all have to understand and figure out together.
Yeah, thank you for that answer. And I appreciate you bringing up seniors too. I created a virtual phone bank where we recruited 60 to 70 volunteers just to call about 7,000 to 8,000 seniors in District 2, just to say,
that's
amazing. You need someone
amazing.
to talk to you. Do you need someone to help you with your medication and your groceries? But, they really appreciated just even having someone to talk to, so I think that that's something we could explore in the future too. And just one last question around the economic distress that many are under. And I'm just wondering, what kind of interventions have you seen that help or that can help those experiencing that kind of economic distress? And if you think there's anything we can focus on in that category.
I mean, I think the recovery pieces, when we do open up, I mean, the sustained support around any kind of economic intervention to offset the unemployment stress is going to be really important, along with supporting folks' safety, right? Like, I think I do know of several people that have been unemployed, and they are balancing sort of that need to be safe. They have young children too, so they're concerned about their own safety and how do they get back into employment that won't put them at risk. So I think those are some considerations, but I think the city is going to really have to think about, in the recovery plan, how do we make sure like the already vulnerable don't like fall into more vulnerability, and I think the new vulnerable, how do they, how do we support their day-to-day? I'm not sure. That's a big question.
Yeah, no, I think you talking about that sustained support is something that we have to really focus on.
Yeah, I think it actually is about expanded support. I think when I talked to the physician over at CPMC, he oversees the whole psychiatric service there, and he was saying that he is expecting, when shelter in place and as COVID does kind of cycle in second, third, fourth, whatever waves, that we are going to see more COVID related kind of emergencies. Right now, he doesn't really feel he's seeing that flow of patients. And the reason I focused on CPMC, partly because they get a lot of the folks that attempt jumping on the Golden Gate Bridge, and they haven't really actually seen any change in their wards yet. But he said that generally when we have these crises, we've seen an uptick just like later, not immediately. So I think it is going to be, I think we're going to need this expanded approach because we've never kind of been in this level of isolation before.
All right. Thank you. Colleagues, do you have any questions?
I believe Supervisor Walton does.
Thank you so much, Supervisor Mandelman and Supervisor Stefani. And I think Supervisor Stefani really touched on most of what I wanted to ask, just in terms of risk factors, but also what do you think us as members of the Board of Supervisors and policymakers can do to help with the prevention side, particularly during the crisis and even as we come out of COVID, knowing that there are going to be larger impacts on people that are going to add to the stressors in their lives.
Yeah, good question, Supervisor Walton. I believe that definitely, I mean, really thinking about your own district and sort of some of the needs that you're seeing to really make sure that our number is widely available and accessible. And I think kind of that's sort of more of a short-term kind of opportunity. But I think long-term, you know, we're going to need to have sort of an expanded strategy because there's kind of new types of anxiety probably emerging. And I think there's also some resilience also emerging. I don't want to say it's all negative, right? Maybe for some, there's less social isolation because everybody's at home. That's what we kind of wonder about with the reduced call volume. Maybe with the reduced call volume also on the flip side, maybe people don't have the luxury of being able to call because there's not as much space to call, you know? So I think what we need to kind of worry about in the city, at the city level, I feel, is to make sure that we do not gut the mental health system as budget cuts come down the pike. We need, and social services, right? Because I think it's all related to housing, food, survival is what we kind of saw in this immediate social isolation phase. And then how do we support and sustain, you know, the mental health wellness, like that physical wellness is going to be equally as important. But figuring out how to expand the budgets and really support, like I said, the existing vulnerable already, and then the new vulnerable.
Thank you, because I know, you know, also just from information from homeless advocates, for example, we see increase of unhoused deaths right now during this time period.
That's right.
Versus last year. We don't know all of the reasons behind that, but I just want to do what we can to try to decrease, obviously, any tragedies that we can. So thank you so much.
Thank you.
Vice Chair Stefani.
Great, thank you, Lina. And with that, I'd like to have Beverly Upton from the San Francisco Domestic Violence Consortium present.
Good morning, supervisors. Can you hear me okay? Yes? Very good. Thank you. I'm joined by my colleague, Emberly Cross from the Cooperative Restraining Order Clinic that I thought could help me with some of the legal questions that might come up today and some of the questions that have come up in the past about domestic violence and the courts and how cases are moving forward. So I want to take this opportunity to thank Emberly Cross for joining me. I also want to thank the Public Safety Subcommittee for bringing this hearing, and certainly Supervisor Stefani and the wonderful Andy and Sam for helping us get where we need to be with the new tools that we all have. Thank you so much. And Andy, my heart is with you. Thank you so much. We also want to thank Supervisor Stefani and the unanimous vote of the Board of Supervisors on the resolution reaffirming the board's support of direct services, not only domestic violence, but sexual assault, stalking, and trafficking. So thank you. That was a great way to help us move forward in the new reality of COVID-19. So we want to thank you. I'll just do a quick overview, kind of COVID and how the community is set up, some background. We'll do a little bit on the individual services. We'll talk a little bit about the criminal justice system. And then we'll just touch on some work that the Family Violence Council is doing. And again, Sam Bennett is our representative for the Board of Supervisors at the Family Violence Council, and I'm honored to be a co-chair there. So it was great to meet remotely for our first time last week and to have Sam on that call. So most of you know me. I'll try to be as brief as I can. My name is Beverly Upton. I'm the executive director of a 17-member Domestic Violence Consortium, the San Francisco Domestic Violence Consortium. I'm so happy to be in my 19th year. The members of the Domestic Violence Consortium have domestic violence programming at their core. In addition to the 17 agencies, we probably have another 30 or 40 brother and sister agencies that do domestic violence work, certainly worthy, but of the consortium, our members are primarily domestic violence agencies. So when we look at who's doing domestic violence work in San Francisco, again, this is who we see as the front line. Of course, as Supervisor Stefani has mentioned, just like suicide issues and other issues, they pop up everywhere, right? So of course, people in other areas see domestic violence as well, in youth programs, family shelters, homeless shelters, lots and lots of social services. It affects every community. Every community holds the seeds that hold domestic violence in place, and they also hold the seeds of liberation, right? So every community has it, and we are just honored to be a part of this. That said, I also want to say that our community is really broad and deep. Emberly and I could never represent the 60 languages and the breadth and the depth and the diversity of the folks that are doing this work 24/7 in San Francisco. So let's start. I will share. This is my first time doing this, so bear with me. If not, if it doesn't work, I'll just walk you right through it. Our main home for this work is the Department and the Commission on the Status of Women. So the first thing I plan on sharing is the COSW report from last fiscal year. Okay, here we go. Well, I don't see it at all. Oh, let me try it one more time, but I will not waste your time because I can walk you through this and you all have the docs. But I'm going to try it one more time. John was so patient with me. I'm sure that we can do this. There we go. Let's try this. Nope. How is that?
We are seeing just a tile that has BU for your initials at this time.
All right.
It did work in our
It did work.
pre-meeting.
Something just, wait a minute, something just popped up. Something
Yeah,
good
it briefly worked.
You think? Okay, let me
Yeah,
try it one more time. And then again, I won't waste the committee's time. We'll just keep moving. If
Is it a
doesn't
PowerPoint
let's
presentation?
try it one more time. See, I'm not seeing anything. What are you seeing?
So you'll want to use the floating menu to select share option.
Oh, yes.
There
I
you
did
go.
that.
You got it.
We're
Very
good?
good. Yeah, if you
Very
bring
good,
this to full
friend.
screen, you should be able to
Wonderful.
see it.
Okay, and just so you know, I can't see it and I can't see any of you. So I'm just gonna move forward, okay? I can't see it and I can't see you, but of course I have my copies. So the community is made up of 2 crisis lines. Now, other agencies do have crisis lines, but the city contracts with Women Inc. for the domestic violence crisis line, and we'll be looking at some of their initial post-COVID numbers in a few minutes, and San Francisco Women Against Rape for the sexual assault crisis line. There are 3 domestic violence shelters in San Francisco. They are confidential. And they really are life-saving services, and we'll talk more about them. I'll just say that they have done a fantastic job in keeping the services up and running and keeping survivors and their families safe. They never stopped sheltering people. I also think this is a great time to say that much like my colleague at Suicide Prevention, Department of Public Health, Dr. Lee Kimberg is our liaison. She started meeting with the shelters, the transitional housing programs, and the Department on the Status of Women and the Domestic Violence Consortium every week to help make sure that they were trained and ready for whatever COVID demanded of them. And it's so far been successful, so thank you so much. I mentioned transitional housing. There are 4 transitional housing programs in the city. Then there are about 25, 26 programs in the city that are advocacy, prevention, training, and I really call them the beloved community. Those may not be traditional domestic violence agencies. Those may be CUAV, Community United Against Violence. Those may be Cameron House. Those may be Lyric, but they are the beloved community that the communities that they serve and the neighborhoods that they're in trust them literally with their lives. And domestic violence is part of their overall work and certainly worthy of our support always. Then we have 5 legal programs. I'll count them off, although I'm so glad Emberly's here. I'll start with hers, the Cooperative Restraining Order Clinic, the Justice and Diversity Center of the San Francisco Bar Association, Bay Area Legal Aid, and Asian Pacific Islander Legal Outreach, and then Legal Services at Work. And that kind of makes up the community. Those agencies, as you can see by this report, are all funded by the Department on the Status of Women. I'm going to try to, okay, hop out of there. Yes? Okay. All right. So if we look at, you could see their numbers before. One of the things I will say is that San Francisco turns to its community-based service providers first for many reasons. You can imagine that the immigrant community may feel much safer speaking with somebody who they're not concerned about any kind of immigration issues, that speaks their language, that understands any of their cultural issues. The LGBTQ community may feel more comfortable in speaking with somebody who understands their issues as well. So, and then certainly San Francisco, mostly through Asian Women's Shelter, but certainly other agencies as well, speak over 50 languages. And so really that's where the community turns for support. When we look at the Family Violence Council numbers, you'll see that more people are calling for support from the community before ever reaching out to law enforcement 911. Okay, so if we look at the post-COVID numbers, okay, I'm going to do this again. Can you see these?
Looks like it is updating. We can see it, but it looks to have a very peculiar zoom. It's only letting us see a small quarter of the upper left-hand corner.
Why don't I let us out of that and I'll just walk you through it. I'll be brief.
For members of the public who may be watching this meeting, I will have copies of all these presentations attached in the Legislative Research Center, so you can refer to them in the future.
Thank you so much. So these are some of the freshest numbers that we have. And when the media calls, when the Chronicle calls, when Atlantic Magazine calls and wants to know how things are in the post-COVID domestic violence atmosphere, we really look first to our crisis line calls. And so I think we're seeing, and my agencies have really been, my member agencies have really been helping me think about this, because the first couple of weeks, we saw Women Inc.'s numbers alone go up 130%. So that was, quite alarming, but they were able to handle the demand And they've just done a great job in counseling people, setting up support groups. They had support groups before, but of course, in shelter in place, we have to figure out how to work remotely. And then working with survivors, you even have more of a challenge because you have confidentiality and safety as the cornerstone of your work. And so that's, even more challenging. So if we look at their crisis line numbers, for March, they had 885 calls. April, it went down to 738. And in May, just the first few weeks, it's down to 220.
Earlier than usual.
Am I okay here? Okay. Which kind of mirrors what our colleague from suicide prevention said. And my agencies have been really helpful in helping me think about these. So the first 2 weeks, it looks like people panicked. They did not feel safe. They weren't used to being kind of locked down with somebody that may have abused them in the past or that they were afraid of. And so they reached out in record numbers. Those first few weeks, we're looking at for Women Inc. about 130% increase. Huge, huge. The next few weeks, people realized that the services were going to be there for them, that they could reach the crisis line 24 hours a day, that those who had no other options other than shelter could still find some safety. Now, the shelters, and I don't mean to speak for them, that is a service area worthy of its own hearing. But they really had to respond to COVID by doing social distancing, more single rooms for single adults, certainly keeping families together. And so they were still able to stay open in the COVID era. But I think the community also benefited by the new apartments that became available through the DA's office and the mayor's office and Veritas. Later, in the last few weeks, the DA's office has also, through the mayor's office, I believe, helped find a few hotel rooms that additional survivors and their children mostly could be in to ensure their safety. So right now we're not totally at capacity, but the need is there. And of course, we're all worried and want to be ready for post-COVID. I think this might be a good time for me to ask Emberly if she had anything she wanted to share about any of the legal programs. I also want to thank Emberly and her team over at the Restraining Order Clinic, who have never stopped meeting and serving clients since day one. Thoughts?
Ms. Cross, I believe that your mic is muted. And it will need for you to unmute your own mic. We're not able to unmute it for you. So if you bring your cursor near the center of your screen, you'll have a floating menu that pops up, and one of the options you have besides turn camera off is unmute.
There. Am I unmuted?
Yes, you are.
You are.
Oh, heavens.
Thank you.
Thank you. Good morning, everybody. I'll just add really quickly what the legal services organizations and the courts have been doing during this time. The legal services organizations in San Francisco have continued to assist domestic violence survivors, of course, throughout the shelter-in-place period. It is obviously more difficult to do this work when the survivor is sheltering in place or quarantining. It's even more difficult when they are sheltering in place with the person who's harming them. What that has meant is we, schedule 10, 15-minute phone calls when the survivor is able to talk, do a lot of it over text when that is safe, when the person who's harming them does not have access to their phone. It means everything takes a little bit longer. Primarily, we've been doing our work with survivors through Zoom or over the phone, but there are archaic rules of court which require that anything we file at court has to have either an original signature or a faxed signature on it. I think one of our clients during this time has had access to a printer and a fax machine, which means that we've had to get original signatures. We can't use scanned and emailed signatures. So we meet with clients either outside our building, where my office, Kroc, is in the women's building in the Mission, or we meet with the survivor outside her home and do as close to a social distancing as we can, as we hand over pleadings and a pen that we have the survivor use to sign the forms, and then we have the survivor keep the pen. The court, each county's courts have responded to this emergency in their own way. San Francisco courts, you know, have stayed open, though with reduced services, but they have continued to handle restraining orders every single day. The court has been reviewing restraining order requests every day during this process. They have also continued to have hearings on restraining orders, live in-person hearings, prioritizing cases where the parties have children together. Two of Kroc's attorneys have been at court every Wednesday throughout this period to staff the domestic violence restraining order calendars on Wednesday mornings and to be there with our clients. Certainly folks have the option to appear by phone. The court prefers that, but a lot of people just aren't able to do that or are really nervous about doing that. They want to be in the courtroom and see that they are being seen and see that they are being heard by the judge, and they have physical evidence that they want the judge to look at. So we've been in charge of maintaining social distancing in the hallways outside the courtroom. We bring one case at a time into the courtroom to be heard by the judge. We, the Kroc attorneys, have sanitized the tables and the chairs and the microphones after each case. We've worked very closely with the court. I would really like to give a shout out to the presiding judge of the family court in San Francisco, Judge Monica Wiley. She has been in contact with us from the beginning, expressing her concerns that domestic violence survivors need to know that the court is open and is having these hearings and is there for them during this period, and they really have been there for them. Unless folks have questions, that's really all that I had prepared, but I'm happy to answer any questions, of course.
Chair Mandelman, I just have a few follow-up questions. Thank you both to Beverly and Emberly for the incredible work you're doing. And just a few questions. You answered my question, Emberly, about being able to still get restraining orders. So I'm glad that we're getting that information out there. And like I said, thank you for going out there and doing that work. And we're going to have to change those archaic rules somehow. So we'll be looking into that. I know that's probably a state thing, but still it's something we could shed light on. And so, Beverly, I saw in the materials that we reviewed before this that only 14% of reported cases that were reported actually to the police department were presented to the district attorney. And I'm wondering if you can discuss why such a small percentage make it to the DA's office.
Certainly. Actually, this might be a good segue just to run through those numbers a little bit. Those are the Family Violence Council numbers. I won't struggle with sharing them. You have them and they're available to the public. I'll also say that they're a draft. Sam joined us from your office, Supervisor, last Wednesday, and the Family Violence Council wants to take one more month and look over our numbers. So what you have is now a draft. I certainly thought it was going to pass, but it didn't, and for good reason. So one of the things that we really want, that we see again echoed, is how many calls are coming into the community. Last year, reported to the Family Violence Council, 8,647, only about 7,000 to 911. But Supervisor, I think your point about how many calls actually get to the district attorney's office is one of the issues that we want to meet with them further about. But it's always possible in a 911 call, especially, that more than one person is calling about a call. And there is kind of a process, as you all know from public safety, for how domestic violence cases get ultimately to the DA's office. And sometimes it can be quite a long journey, right? So they may start by calling 911. 911 will probably send out a police car, but of those 7,000 calls, they're not all 7,000 separate cases, right? So then you have a responding officer. In certain areas right now, there's a pilot project where that officer even has a La Casa advocate on call to speak with a survivor when they roll up to the scene of the crime, or the domestic violence, perhaps the incident. So then it goes from the responding officers, and again, this is worthy of its own hearing. This is not my area of expertise other than my experience. Then it goes to the special victims unit, as do child abuse, elder abuse, stalking, trafficking, financial crimes, and internet crimes against children. So it's quite a busy unit, special victims unit. Those cases go there and then they're investigated. That takes some time, and then they're presented to the DA's office. And then the DA's office decides what their course of action is going to be. And there are many factors, and again, not my area, but worthy of its own conversation, I think. But you are seeing what the domestic violence community nationally sees, which is, the pyramid, I'm holding my hands like this, right, is it really starts in the community, then it builds. And that can be the seriousness of the domestic violence. It can also be more third-party involvement, schools, neighbors. Then you see the most serious cases being presented, and then the decision from the district attorney's office how to take them forward. And I'll just say, the Domestic Violence Consortium, and I would say nationally, the domestic violence community does not see mass incarceration as a solution to domestic violence. That said, certainly there are individual cases that present public safety risk. And so those are cases that I think you would want to know more about, and how the community and the criminal justice system is responding to those cases. I would also say one good criminal justice response that we've seen is really fast tracking the text program for 911. So for survivors that did not feel safe in calling and verbally talking about what their issue was, to be able to text has been a big step forward. We do have a couple of model cities, LA, and here in the Bay Area, Richmond, that we know of, and there could be more. It's just getting off of the ground. It's not perfect. It only recognizes English right now and no character languages other than the Roman or the alphabet, right? So there's clearly more work to be done. We are also honored to sit at the language access work group with the police department and the Department of Police Accountability. And so we'll be working on that, I'm sure, as we move through this pandemic. We certainly want to have equity for all of these services. But that said, it's still a huge step in the right direction.
Thank you, Beverly, for that answer. I will definitely be following up with you on all of that. Especially we need to make sure that we are, it's not just in English, the text. So I want to follow up on that for sure. And everything you said about SVU, I think that there's some more digging we can do there. I also saw in the materials, and you know how I am about gun violence, and especially when it comes to being a woman in the United States, given the fact that we are awash in guns. And it seems from the materials that there was a 44% increase in armed assailants, and which is very dangerous for women, not just women, but typically it's usually women. And I'm just wondering if you have any insight onto what caused that increase. I know we've seen a lot of panic buying of weapons during this time. If you could touch on that a little bit.
Yes. Oh, I would be happy to. And I have to say, Supervisor, that I've really been leaning on our colleagues at the Giffords Foundation for their just breadth of knowledge around domestic violence and gun safety. We are seeing panic gun buying, especially just like the crisis line, right? Up 130%. So gun buying and panic ammunition buying from current gun owners just skyrocketed. And this is anecdotal, but I was on a webinar the other day, and a gentleman, a retired ATF agent, said that the first few days after the shelter in place nationally were the highest gun buying days since 9/11. So whatever that means, you can interpret that 100 different ways, but I think it's significant. Another thing he brought up was how many people are first-time gun owners, buying guns for the first time. Some people certainly are using it to intimidate their partners and their families. Some people have a misguided idea that somebody is going to come for their toilet paper someday, and they want to be able to defend themselves. But it's very serious. I think we're in unprecedented times of seeing untrained gun owners locked in their homes with their partners and their children. That is concerning. And I know Supervisor Stefani shares our concern. Now, certainly our colleagues at the Sheriff's Department and probation are going out and trying to retrieve guns from parties that have restraining orders against them. But of course, it's quite concerning. We have lots of people who are brand new gun owners that just went out in the first few weeks after COVID and applied. And if they didn't have any criminal background, they might have been allowed to buy their gun fairly early. And what we learned from this retired ATF officer was that because shelter in place, most people have not received any training.
Right.
So you have people out there with brand new guns, lots of ammunition, lots of stress, possible past abuse, lots of tension in sheltering in place with their families. Very disturbing.
Thank you, Beverly. And before I turn it over to my colleagues, if they have any questions, I just wanted to follow up. I know, Emberly, we talked about the restraining orders, the domestic violence restraining orders, but there are several types of restraining orders. And Beverly just brought up something that I've been working on, that we passed legislation on to create a robust gun violence restraining order program. So for those people that have guns that may not have had a domestic violence incident yet, a gun violence restraining order is something that people can still get at this time. And I just want, that is a restraining order that if you believe that somebody is a danger to themselves or others and has guns, has weapons that need to be taken out of the home, you can petition the court and reach out for what's called a gun violence restraining order. And Emberly, if you can just touch on that really quick.
Yes, the judge who issues the gun violence restraining orders has continued reviewing those applications. I don't have information on numbers of petitions, if any, that have been filed for those during this time. That same judge is also reviewing every day the petitions for what we call civil harassment restraining orders. That is a similar type of restraining order to the domestic violence in that it can order the restrained party to have no contact with the protected party and to stay away from the protected party. Civil harassment orders are used in situations where the parties did not have a relationship that would make it a domestic violence restraining order. CROC, for example, assists survivors of sexual assault and stalking who are outside the context of a relationship in getting those civil harassment orders. The judge has been issuing temporary restraining orders, but there have not been hearings happening in those cases. Temporary restraining orders have stayed in effect, but the hearing dates keep getting what we call continued or postponed until it's going to be safe for everybody to be in the courtroom. I know the court is planning to reopen its services on Monday, on June 1. With safety precautions in place for social distancing and limited number of people in the elevator. So it's going to take a lot longer, just practically speaking, to get into your courtroom for your hearings, just because you go upstairs in the elevator and they have a limited number of elevators. But the court is reopening. I expect we'll be seeing those hearings happening soon.
Thank you so much. And Supervisor Mandelman, Chair Mandelman, if there's anybody that would like to ask any additional questions?
I have a couple, sort of two categories. The first is domestic violence and its relationship to homelessness. And I know that's a big, huge, giant topic. And particularly of folks staying with their partners because they're afraid of losing their housing, and then what happens when they do go seek help, and then add on the overlay of the pandemic and the sort of challenge. My understanding is the increased challenge of finding any kind of shelter anywhere that is taking people in. All of that, and then on top of that, there are people who are out. There are people who are out on the streets who are experiencing domestic violence with partners. And I'm thinking of a particular woman in my district who is actually. I think she has even gotten a restraining order. But when you're on the street and you live, one block down from your domestic violence abuser, this is very complicated and so and dangerous actually. And so I was wondering if you could just talk a little bit about the way these things are overlaying, domestic violence, housing insecurity, and then COVID on top of that, and what's available for women who are currently housed but fear the loss of that housing if they separate from their abusive partner, and what's available if you are on the streets attached to someone who is abusive, if anything.
Well, it's going to be a complicated and probably incomplete response, but I'll start by saying that studies show us that domestic violence is one of the leading causes of homelessness for women and children, that people will leave their homes to try to keep their children safe. And so many women and parents in general end up homeless due to domestic violence. Certainly, we do work with the family shelters. I'm thinking of Hamilton House and a few others to try to support families that are maybe facing homelessness, may have had domestic violence, and may still be trying to stay together, right? Then I think we have a more complex and probably less effective solution, which is trying to work with folks that may already be unsheltered. And I think there we're looking at some of the other agencies that might not be seen as traditional domestic violence agencies. We might be looking at the Hope Center for a safe house, right, in the Tenderloin. We might be looking at Glide, another beloved community that I cannot believe I forgot to mention. One of our stellar members is Glide, and they really have been able to help in the homelessness and domestic violence in overlap. So there's that.
I assume that any of those providers right now are stretched to the, if they were already stretched to beyond the breaking point, and now there's even less available. I don't know if they're the same kind. I mean, with a family shelter, I don't know if they have the same kinds of imperatives around thinning out, because typically family shelters, I think, the families do have their own bathrooms at least, but it just, I have concerns.
Of course you do.
Yeah.
Right. As well you should.
Yeah.
But I do think, the community is, as I said before, broad, deep, and diverse. And so we are able to pull in other communities, especially folks that have been working with unsheltered women, as I mentioned, like Safe House and the Glenda Hope Center over in the Tenderloin. Certainly Glide has been helpful. But I think your instincts are absolutely right, Supervisor Mandelman. This is going to be very, very difficult.
And can I add, from the legal side, if somebody decides that they do want to request a restraining order, one of the forms of relief in a domestic violence restraining order is a residence exclusion or a move-out order. So somebody can go in and get the partner who's using abuse ordered out of the home, but then we get into more complexities, as Bev would say, because we're working with so many survivors who they don't want to become homeless themselves, obviously, and they also don't want their partner to become homeless. So they decide not to file for a restraining order. We see the same thing in terms of calling the police, because so many of our survivors don't want, just in general, don't want to have this person arrested or put in jail, but especially now don't want it because they're afraid that the person either might get exposed to COVID, although I'm glad to hear we're not having that happen in San Francisco, or that the person might not be held at all after being arrested and then might be much angrier that the police got called at all. We've certainly had clients who tell us the person who hurt them was arrested, released with an ankle monitor that the person then just cut off and left on their mailbox or texted a photo of to them.
Right. And that kind of raises my second bucket of questions, which I know is not the topic of it's not the primary topic of this hearing, but it kind of goes right up to it, which is also COVID related, and what is happening sort of with the imperative around thinning out the jails, which is from a public health perspective very correct. But I have also heard these stories, and I don't have a sense of how, whether it's anecdotal or whether it is systemic, of, you know, situations where an accused abuser is taken in, but is essentially out immediately. Is, you know, and in part I'm understanding because of kind of the imperatives of the sort of change policies around COVID and around not holding people, and that the most likely place for that person to go after being, you know, released, you know, if the abused party is willing to have them back, is for them to go right back to that home, which is challenging. Or they can just, you know, you're describing in a situation I have not heard, which is the threatening and angry abuser, you know, sort of taking a picture of the broken ankle monitor and, you know, essentially communicating, I could come for you anytime I want to. It raises, again, I don't want to say that this is more than anecdote, but if it is more than, I mean, it is an anecdote. If it's one or two stories, that's terrible. If this is happening in some kind of like systematic way, then we are going to have horrible stories. We are going to be, you know, upset and thinking that we could have done something differently for having created sort of an untenable situation where we're pushing abusers and abused back into each other's worlds. So I don't know if you have anything to say about what's happening with kind of the jail protocols and the way these crimes are getting charged right now, but I was curious what your perspective was.
I'll jump in on this, that we've been really leaning on our sheriff's department, on our partners in the sheriff's department. Deputy Sheriff Kathy Gorwood and Michelle Fisher have been so sensitive to this issue. They started doing victim notification early on when it looked like early releases were going to start happening. And so they've been doing this for quite some time, but they really raised the bar. They're watching very closely and then contacting the survivor, the victim in the case, if they at all can, to let he or she know that their partner, their abusive partner, has been released. So it's certainly not perfect. It's certainly not bulletproof, but it is. It's a step in the right direction. And we just find ourselves in this very unique and very complex time, I think, in the criminal justice system. Yeah. Especially married with the COVID.
Yeah. No, I mean, that adds this whole additional layer to all of these problems.
Yes.
Which is why it's a good thing that Vice Chair Stefani called for this hearing.
Yes. Yes. I forgot something, and I just wanted, while we're all still here, just to also say food security from our agencies to the folks that they're working with. It's not in the numbers, I don't believe, but I remember speaking with Women Inc. the first week or two, and they let us know that their board had appropriated $2,400 for them to give to clients. Those are basically survivors of domestic violence that were worried about how they were going to put food on their table for their kids mostly. And that we're seeing in, every aspect, every layer of the services. The beloved community that I talked about, Cameron House, Glide, they are giving out groceries at record numbers. Families are afraid of not being able to take care of their kids and put food on the table. Also, sometimes it's also one of the factors in the abuse. If you leave, you can't come back, or if you don't leave, you know. So, but anyway, survivors of domestic violence are doing really a lot of extra work to try to, you know, secure food for their kids and their families. And so this is an area where the domestic violence community has really stepped up. You know, I'll also just share, much as my colleague from suicide prevention did, we too are up for serious budget cuts for direct services. As you know, I don't do direct service, but I work with those who do on a daily, minute by minute basis. The Commission on Status of Women met last night. They don't really see any other way around an RFP that would reallocate about $500,000, and then the mayor's office is currently looking at probably another $500,000+ cut. And so that's $1 million out of direct services. Yeah. And so, you know, that's very, you know, that's worrisome, because we're all worried about what happens when things start to loosen up. Are we going to be overrun, and are we going to be able to meet the need? So instead of hiring new staff, the agencies might be looking at reducing staff. And so we, you know, we don't want to find ourselves there if we can help it.
Very alarming. Well, unless Vice Chair Stefani has more, or Supervisor Walton has any comments or questions, we could comment.
I didn't even tell you this. Ivy said that, you know how Angela's
you got something going on.
The office?
This true.
No comments or questions on my end. Sorry about that.
Oh, got it. That was okay.
Okay.
Thanks, Supervisor Walton. Mr. Clerk, do we have any public comment?
Thank you, Mr. Chair. Operations will check to see if there are any callers in the queue. Mr. Koo, please let us know if there are any callers that are ready. For those that have already connected to our meeting via phone, please press star and then 9 to be added to the queue to speak for this item. For those already on hold in the queue, please continue to wait until you're prompted to begin at the beep. For those who are watching our meeting on cable channel 26 or via a streaming link or through SF TV, if you wish to speak on this item, please call in by following the instructions on your screen. Dial 415-655-0001. Enter the access code. The access code is 926116335. Press the pound symbol twice and then press star and then 9 to be added to the queue to speak. Mr. Koo, do you have any speakers?
Mr. Chair, there are no callers wishing to speak.
All right, thank you, Mr. Koo, thank you, Mr. Clerk. We will then close public comment. Vice Chair Stefani, did you have any concluding remarks that you wanted to make?
Yes, thank you, Chairman. I just want to thank Lina, Beverly, Kimberly for coming and presenting today. You are 3 incredible women that I admire greatly. Thank you for the work that you do, and thank you for the work that your organizations do. It's absolutely critical to keeping our residents safe. I also want to thank our partners that Beverly mentioned, you know, those in running the shelters and our legal agencies. And as you mentioned, Beverly, our beloved community who helps guide all this work and really save lives. And also want to thank again my staff, Andy and Sam. Sam's representing me on the Family Violence Council. Andy for helping put this hearing together. I'm very lucky to have those 2 working for me on this. And the final thing I want to say is, for who's ever watching or might be scrolling later on when this is replaying on SFG TV, and who's struggling, again, I cannot emphasize enough that the strongest thing you can do is ask for help, and there's absolutely no shame in needing it. The stigma around anxiety and depression and suicidal thoughts and recovery and addiction and all of that has to go. There are so many people that are in your same circumstances that you might not think are, and you are not alone. So please have that courage to pick up the phone and call someone. And in doing so, you really create a pathway forward for so many other people who are struggling as well. So I just want to say, please, there's no shame. Reach out. We are here for you. We will make sure the resources are always there. And finally, given what we're seeing going on, and we all kind of alluded to it in terms of our what we're going through with COVID-19 and this climate we're under and the angst and the anxiety and how people are treating one another, we see it from the top down and how ugly it can really be. And I was thinking about that one quote that people say, you know, be kind because you don't know what other people might be going through. And if, you know, I used to tell my staff when I was the county clerk that they might think that they are just helping someone with a marriage license, or they might think that they might be just helping someone get a birth certificate. But in that interaction with another human being, you smile at them, you ask them how they're doing, you compliment them, you have the power really to turn someone's day around. So just be kind. And I know we're all going through difficult times, and again, that's okay. But I want to thank my colleagues and thank everybody that's presented today. I think this is a topic that is so incredibly important to me for many different reasons. And again, I can't thank you all enough for this hearing today. And with that, Supervisor Mandelman, I think that I would just like to make a motion to file the hearing.
All right. We will vote on that motion. Mr. Clerk.
On the motion offered by Vice Chair Stefani that the matter be heard and filed, Vice Chair Stefani.
Aye.
Stefani, aye. Member Walton.
Aye.
Walton, aye. Chair Mandelman.
Aye.
Mandelman, aye. Mr. Chair, there are 3 ayes.
The motion passes. Thank you, Mr. Clerk. Thank you, Vice Chair Stefani. Thank you to all of our speakers.
It was an honor to be here. Thank you so much.
Thank you so much.
Thank you.
Mr. Clerk, do we have any other items today?
There is no further business.
Well, then we are adjourned. Thank you. Thanks, everybody. Have a good rest of your day.
Thank you, you too.
Thank you.